Hi, I'm Lauri Kane, and I am the administrator of the Plastic Surgery Office of Dr. Dean Kane, wife of Dr. Dean Kane, and patient of Dr. Dean Kane. So every year I go through my annual Fountain of Youth procedures, which I use Sculptra to stimulate collagen, elastin for firming and tightening. I will be doing Sculptra on my face and neck, possibly my arms, and as well as a TCA chemical peel on top of my face and neck, and that is to give me good exfoliation and good tightening on the outer part of my face. So the TCA peel gives me some great outside tightening and firming, while collagen gives me great inside firming and tightening, and the two work beautifully together. This will be my 8th year of using Sculptra. I am now 66, and I had a facelift 7 years ago. So to maintain my facelift, this is what I do. All right, follow the process with me. So we're going to go through the step-by-step process of actually how Sculptra is applied and how the TCA is applied. So Joy, who is Dr. Kane's right hand, left hand, every hand assistant, there's Joy, is now cleaning my face. She'll be cleaning my face, neck with alcohol. And then after we get my face nice and cleaned off with the alcohol, she will then apply, sorry, that's okay. That's what alcohol does. She'll then apply the numbing cream. You're good. The numbing cream, so that we have 2 levels of numbing. The first level is that we use an ointment. I'm going to sit with the ointment for 20 minutes. So at least the skin itself has some numbness to it. And then Dr. Kane will be coming in and then actually doing some physical numbing on me with local lidocaine injections, so that when he goes to start the Sculptra, I'm not going to feel the Sculptra. There you go. We'll get to the next step when Dr. Kane comes in to numb me up. See you in 20 minutes. All right, so the next step is Joy is going to wipe off the ointment that has been numbing me for 20 minutes. So my skin is fairly numb. I shouldn't have touched the place she just alcoholed, but this is, so that's the step that she's doing. And then as soon as she finishes wiping me off, then Dr. Kane or Dean
is
going
to identify by
inject.
guidelines, okay, where I'm going to be injecting. It's going to be multi-level. So we'll be looking at the temples, the cheeks, the lines around the eyes, the lines around the mouth, and the folds, as well as contouring the jawline and stimulating the skin to contract. So all those guidelines are going to help me inject. I will then give her some local anesthetic so she doesn't feel the bigger needle associated with Sculptra, and then we'll go to work. So one thing that we've identified is that the hollowing that you see in the temple can actually improve everything from the jawline up by filling and pulling, as well as the contracting associated with the Sculptra. So we're going to do that. I'm also going to try to build up a wider cheekbone so that she looks younger and heart-shaped, and a fuller cheek so that we develop the Nike whoosh. From the lower level, we're going to form a bit more of a neck definition by developing a little bit of strength or firmness along the jawline, and that's going to add to the beauty of the face by allowing this to depress just slightly, creating a hollow here, a highlight, and a highlight. The rest of it will be for support in the marionette, nasolabial, lateral commissure, and then I'll just gently go across here in terms of what Lauri's needs are in order to stimulate contraction of the skin. Lip lines we will do chin line.
It's getting down to...
Okay. And for those people that need it, we can actually stimulate the jaw to form more bone and create almost like a little chin implant by just adding some form here. If you look at Lauri's neck, go ahead and bend. All right, you'll notice we've injected your neck before, right?
This will be my third time in the neck.
Okay, and you can see she almost has no necklace lines. Why? We've injected those lines before. They have formed collagen. They're forming resistance to forming again. So we're going to go after those necklace lines one more time.
My goal is to also thicken the neck skin and make it less crepey. So even though I had a facelift 7 years ago, you know, the aging process still occurs, and I'm starting to see the skin laxity after 7 years come back. So the goal...
we want to firm that skin, create resistance from forming lines.
So I use Sculptra, and then you'll see that I put a TCA chemical peel on top to again give me a firmer, tighter face and neck.
Now I'm injecting right underneath the skin so that Lauri will feel less of the needles as we do it. I'm numbing underneath the skin, and then I'm going to go down deep to where the nerve is so that Lauri will have less sensation when I inject her with larger needles that contain the Sculptra. Okay, my technique is to use individual syringes and 1 cc aliquots of Sculptra. So it's a very fast-paced way to be able to inject, and the patients seem to be able to tolerate it better. It also gives you a greater diffusion of all the Sculptra in the subcutaneous tissues at different layers so that we get all of those underlying fibers as well as a subdermal collagen to be able to contract. So we'll start with number 1.
All right, so I'm numb, so I'm not feeling this. So it looks worse than it is because he numbed me up and I'm not feeling the injections now. And what's nice about Sculptra is that you could go nice and close to the eyes where you can't get this close with a filler. So that's what makes Sculptra, you know, really great for creepy skin around the eyes. It does really help do, kind of help remove the crepiness and fill that out close to the eye that you can't get with fillers.
With my technique.
With his technique.
We're doing this to tighten not only the skin, but the fibers underneath to develop this very beautiful jawline that you can see.
Okay, so this is the best ending that you could have after Sculptra. So Dean finished injecting my face and neck. That's all done, and now Joy is massaging, and I could just be here forever. She is the best at doing this, and the goal of why we do this is Sculptra has the 5-5-5 rule, Dean has the 6-6-14 rule. The goal is to massage at least 5 minutes a day. I'll do Dean's rule. 6 minutes a day, 6 times a day, 6 minutes each time for 14 days. And that the goal is to really make sure that the Sculptra is evenly spread out throughout the face. And the only slight risk of Sculptra is tiny nodules, which we don't have a problem with because of his 6-6-14 rule. And that's because if you massage enough, you're breaking up the ability for the Sculptra to form these little tiny, tiny nodules. You don't really see them, you feel them sometimes. If after massage you still might have one, then you come on in and Dean will break it up for you. But we don't really have that problem anymore because of his 6-6-14 rule. 14 days where you massage the face and 6 times a day for 6 minutes. And you have to take Joy home with you to do it.
And when doing the neck, you can't massage simultaneously.
Oh yeah, so the neck. You do not do 2 hands at once. Explain why, Joy?
You have carotid here.
And so you don't want to press on both of those at the same time.
So let you knock yourself out.
Yeah, you'll knock yourself out. We don't want you to do that. So you do one side at a time. And we give you the massage cream to do this with. Oh, this feels so good. I'm in not any pain at the moment. Everything is pretty numb. You see any bruises on me?
Absolutely.
A couple?
Absolutely.
Yep, I'm gonna have some bruises. So here's the thing with Sculptra. You gotta plan to have bruises. The good news is some of us are still wearing masks. But the mask hides everything. You gotta plan your social life around that you potentially are gonna have bruises for the next 8 to 10 days. They go away. It's not like the whole face is purple. It's just, you can see there's a lot of injections, and so where you stick a needle, you generally gonna have a little bruise there. They do go away, and you can see that I look good. Nice and full of fluid. The fluid full today. The fluid will go away in about 3 days, and I'll go back to a normal looking face. You don't really get much swelling, believe it or not. You just really get some bruising, and that goes away. It's worth it. The next step is going to be the TCA chemical peel, so stay tuned in. I just had the Sculptra and now I'm doing the TCA peel, and the reason why I like doing them together is one, recovery, because the peel will take 7 days to recover, so it's kind of works perfect timing with the bruising and the peeling, so I like to combine them. So here you start.
Okay, so I'm going to start with a 20% TCA full face peel, and we'll go area by area until I can see the actual frosting process or the coagulation process of the skin levels occurring. We'll fan Lauri because that really takes away a lot of that intense burning, and we'll just proceed beginning around the eyes, then nose, forehead, around the mouth, and then the rest of the cheek, and then onto the neck.
So the nice thing is that you could TCA the upper lids and the lower lids, which is great. So you could get some nice tightening actually on the eyelids themselves. So he uses a really small Q-tip, as you see. He's very, very skilled and very, very experienced at this. He's safe in his hands to do TCA around the eyes like he does. And some people, what we do is we just do TCA around the eyes. You don't have to necessarily do a full face.
Or around the lips for the eyes.
Or around the lips. I personally do a full face because it tightens my whole face, but oftentimes we can just do, like Dean just said, upper lip for lip wrinkles, and crepiness on the eyes, and on the lower lids. This is perfect actually for somebody who has festoons or bags under their eyes. We've been doing a lot of this for patients who have actually very full, pretty full bags. I don't have bags, I just have crepey skin. But it works beautifully to flatten the bag and flatten those
by
festoons.
tightening the skin over it there's really nothing you can do for seasonal allergies with festoons or festoons associated with the use of HA fillers that we're seeing more and more of now.
Let me just explain. A festoon is when you kind of, in this upper cheek part, you have this little round, full
Water
bubble or bag. That is a festoon. And this works beautiful. Nothing else really works well except trying to tighten the skin over that full baggy look under that on that cheek where you have the festoon. So it's slightly burning, not terrible yet. I would say it's a 3 or 4 out of 10 so far. Am I frosting yet?
Just the tiniest little bit.
You want to kind of get closer. The goal is to get a white frosting. That's when he knows that he's gone into the depth that he wants to go into. You could go different levels with this peel, and so he is.
And while it's called a peel, it's not a salon peel. It's not a glycolic acid or salicylic acid peel.
Can you stop for a second? Pretty almost much done with my eyes, and if you look up close, you can see that the eyes have a nice white frosting to them. And now he's going to other parts of my face. What's nice is the way he does it is that when you feel like you can't handle any more in one spot, he goes to the next. And as soon as he stops, it kind of calms down. So even though it's kind of real ouchy, he moves around the face enough so that you get to tolerate, he gives you a rest in one spot and you get to go to the next spot. And the fan, believe it or not, really, really, really helps.
I'm going to go now and start extending the neck frosting down onto her chest over here.
So this is good for crepey chest skin too. So it kind of like works all over the place. Not only does TCA chemical peel help with tightening, but it gets rid of most of your brown unwanted sun damage. So any uneven pigmentations really exfoliates the brown pigmentation. And that's why I like it on my chest, because that's where I seem to get the brown issues. I've controlled a lot with my face and neck, but my chest still has that old sun damage.
All right, so we're all finished with the TCA peel. I did full face, neck, and the décolleté area. You can see the deeper frosting in the décolleté because that was the part that was done last. But she still has frosting all throughout, and that's just the changes in the skin as the TCA acid is penetrating through it. And she'll go through this process where the new skin will develop underneath. The old skin will turn brown and crepey, and it won't actually break and start peeling in sheets until the new skin has come up to the surface.
Like really no pain at all now. Like, so he finished 5 minutes ago, and the heat that was there is already subsided substantially. And the recovery will be painless. There's no pain involved in the recovery process. So I'm done, I'm cooked, but I'm back to feeling fine. In fact, I'm going back to my desk in a few minutes. I love this TCA peel.
So keep peeling.
Mm-hmm. Okay, so literally I had the Sculptra TCA peel about a half hour ago. I'm absolutely 100% having zero pain. I'm at my desk working again. So, I mean, there's really no downtime to it except for some of the bruising, and there's really no pain afterwards. So I'm here working, getting your phone calls. Just give me a call, 410-602-3322. Happy to talk about anything you'd like. This is Lauri Kane signing off. Check in for my daily updates though.